Rahim. So this is part 3 of ECG. So in this ECG I'm gonna describe how to calculate the axis by using perpendicular method. So let's draw the hexaxial system that we're gonna use for the calculation of axis. So we will have the lead one that is placed like this. So this is a lead one, okay, so it is placed like this, okay. So we'll have 0 degrees and 180 degrees here. Then perpendicular to this lead we'll have another lead that is called as AVF lead, right? So we'll have the another lead that is AVF here, that is at plus 90 degrees. So positive side is downward and negative side is upward in this hexaxial system, right? So this will be minus 90 degrees. Then what we need to do, we need to place the leads at 30 degrees, right? So if I place at 30, so 0 30 degree, this will be minus 30, then we'll have minus 60 degrees, right? And this 90 degree, and then if we add upon 30 degrees, so it will be minus 120 degrees, and then we'll have the minus 150 degrees, right? So leads which are placed here, so we'll have two leads here. One is AVR, right, that is present at minus 150, and lead AVL that is placed at minus 30 degrees, right? So AVF is definitely at plus 90. So if I pull this lead, AVL lead, on the opposite side, so it will be making like that, so it will be at plus 150 degrees, right? If I pull this lead, right, so it will be making plus 120 degrees here, right? So right, so if I pull this lead, so it will be this is gonna make 60 degrees here, plus 60 degrees here. And if I pull this lead, so it is gonna make 30 degrees here. So sum will be equal, like if we add this lead and this lead, AVR lead, if we add up these, so sum will be sum should be equal to 180, right? Like if we consider this lead, right, so and this lead, so 120 plus 60 is equal to 180 degrees. So all of these, if we add each of these, so sum should be is equal to 180 degrees. So this is additional point here. So let me erase this data from here, okay. All right, so sorry. All right, so let me name the other leads, right? So lead 2 is placed at 120 degrees and lead 3 is placed at 60 degrees, right? So we have all of limb leads they will present here. So we have 1, 2 and 3, right? Then we'll have AVR, AVL and AVF, right? So to calculate the axis by using quadrant method, or that is also called as thumb method, we will have to consider these two leads, 1 and AVF. We usually see these two leads, right? So if I draw the if we check the perpendicular lead, so you can see that 1 and AVF is perpendicular, right? So you can see 1 and AVF, these are both perpendicular to each other. Like here 3 and AVR are perpendicular, right? So like we'll have this lead 3 and AVR, so both of these are perpendicular to each other. And 2 and AVL, so it is making a cross. So whenever we check the leads, so these are in cross fashion, they are perpendicular to each other, right? So having said that, so what we need to do, I have an ECG here to practice here. So we'll have the lead 1 that is perpendicular to AVF, sorry, right? And 3 will be perpendicular to AVR and 2 will be perpendicular to AVL. So in step 1, to calculate axis, So what you need to do, so let me add one thing here. If vector is falling in minus 30 to plus 90, right? So it is a normal vector. So normal direction of vector is like that. So it will be falling between minus 30 to plus 90. So if it falls in this area, so it will be normal. And when it falls between plus 90 to plus 180, so it is said that it is having the right axis deviation, right? If it falls between minus 90 to minus 30 to minus 90, so it is called as the left axis deviation. If it falls between plus 180 to minus 90, so it is called as the extreme axis deviation, right? Extreme axis deviation, right? Okay, so having said that, so let's come back to ECG. So first step one is to check equiphasic lead, right? Equiphasic QRS in limb lead, right? So step one is to check equiphasic, equiphasic, we're gonna say for that lead which is having equal Q and equal R and S complex, right? So in these leads, so you can see one is not having the equal R and S complex, 2 is not having that, 3 is definitely not having that, AVR is not having. So we can see the AVF is having the equiphasic. So we are considering AVF as having equiphasic lead. So once we identify equiphasic lead, so we need to check what is perpendicular lead for AVF. So lead 1 is right, so lead 1 is perpendicular to AVF. So we need to check the QRS direction, whether it is positive or whether it is negative. So if it is facing positive, so it means the vector is on the positive side, vector is on same side where lead is placed. So let me go back to this. So we have seen the lead AVF is having the equiphasic. So equiphasic lead, we have considered AVF as equiphasic lead. So if we see the lead 1 is at perpendicular side, and QRS complex was facing upward, it was having the positive direction. So this means that lead is placed at 0 degrees, right? So if it was negative, so we have to move, we need to move on the other side. So if it was like negative, if it is the QRS complex direction was negative, so we had considered it as negative, so we had to move to the 180 degrees. So since it is positive side, so we have to consider the area where lead is placed, so it is 0 degrees. So it is falling between minus 30 to plus 90. So it means this is having the normal axis, right? So this is a normal axis, right? So let me practice another ECG, right? So okay, so you can see the lead 1, right? This one is lead 1, 2 and 3, then AVR, AVL and AVF, right? So let's check which one of these is equiphasic. All right, so in these leads, so you can see the limb lead 2 is in this, seems to be equiphasic, right? So we have to choose the equiphasic or close to equiphasic lead, right? So perpendicular to this one is AVL, right? So perpendicular to this is AVL. If it was 1, so we had to consider AVF. If it was 3, so we had to consider AVR, right? So since the equiphasic the lead perpendicular to equiphasic complex is AVL, right? So we can see the vector is facing downward. So QRS complex is facing downward. So this means negative. It means the vector will be on the opposite side where lead is placed, right? So let's go back to AVL. So all right, so here is AVL, right? So since the vector is negative, QRS complex is facing downward, this means the vector is on opposite side, right? So it is on opposite side. This means the vector is on the vector is on 150 degrees, right? So this means the patient is having right axis deviation, right? So since it is falling between plus 90 to 180 degrees, right? So that's how we're gonna calculate the axis, right? So that's all for today. So see you in the next video.